Okay, thank you guys for joining. We have our first Thursday of the month, and tonight I'm going to talk about elevating your self-care. So last month I did a little presentation on fascia, kind of just educating about what's going on in the body and what is the fascial system. So if you missed that and you'd like to know more about that, go back to last month. It will be, the recording is there also in YouTube. So I am going to go straight to this little presentation that I have just to kind of keep me on track a little bit and share with you my story. So, one of the things that I do with people every day in the studio is share how people can treat themselves, basically, and how do you go about doing that. And it's tricky, when I'm trying to do this in a short period of time, I'm trying to bring all of these years of experience of working on myself into a few minutes sometimes, and that's tricky, and it's probably not super effective oftentimes. So I've done things like created the YouTube channel, and we have the Facebook group that I try to put things in, but sometimes it gets hard with my schedule. So I thought I would just do like a little summary of where I've been over the years, because I never really get a chance to do that. Whenever I'm working with people, it's like I'm trying to tell them what they need to go home with, and that's their homework, So I don't get a chance to go back and say, well, here's why I feel like you need that, because this happened. Okay, do you guys see the screen? Looks like it's just give me a thumbs up. Somebody, okay, awesome. I am going to play this. So obviously, this is my self-care. Obviously, it's great if you can get treated hands-on yourself by a therapist. That's wonderful, but sometimes we don't have that opportunity, right? And there's lots of reasons for that. So what I discovered early on was, from the very beginning, I didn't have the luxury of having a therapist in my town. So that's kind of how I created all of these self-treatment options. So just a little bit about my story. Personally, I had lots of headaches as a kid. Like I can remember, and I was probably 5, 6 years old having headaches and telling my mom, I was hurting and taking the baby aspirin and all that kind of stuff, back then. And I don't really know if I had a reason for them other than I remember them a lot. But it wasn't like they were, totally keeping me from doing activity. It was just something that I lived with. And I don't know if I had them every day, but I certainly was no stranger to them. And I wasn't a kid who was in, sports or anything, other than when I was about 15 years old, I started martial arts. So if you know anything about martial arts, there's all kinds of things involved in that. And we were in Taekwondo, and there was a lot of, kicking and hitting. And yes, we did stretching, but it was kind of forceful stretching. And I did get banged up here and there, but we just kind of plowed through it. It was like tough. You were being tough. No other sports, but I did do a lot of sitting. So I had a lot of school. Right after high school, got into accounting. And so I was going to college and working, and never learned about what to do when you felt tight. I didn't even know what that was. You just plowed through stuff. You just made it through your day, and when I started being an accountant, and I was working like during busy season, sometimes we would be sitting at a desk for 12 hours a day. Like that would not be uncommon. And you're sitting there writing. This is when we had, there weren't laptops back then, but we did have these like bigger Mac computers. So you're either sitting at a screen or you were looking down at your work papers and you were writing. So there was this forward posture a lot. and strain, a lot of eye strain. And so those headaches that I had just got worse and worse and worse. So I started going to chiropractic, and that helped somewhat. But during that time, I realized I didn't want to be an accountant anymore. I continued on in college, but switched my major to exercise science. And that was when I became a fitness instructor, and I just loved it. It was also when I started running. So I was actually getting some movement. What I didn't realize at the time was I was now affecting my myofascial system in a different way. So it changed the pattern I was having, and the headaches that I was experiencing decreased, which was great. However, I continued on this. I loved running. So I just, quickly started amping up my mileage and started running marathons, started doing triathlons, because the too much running started giving me pain and injury. So then I switched my activity, which was cool, because then I started getting different movement. So again, that was changing my fascial system. Didn't realize that, but it gave me some relief. So then I switched from exercise physiology after I graduated from my master's degree then, and went into PT school. And that was when I got my introduction to John Barnes myofascial release. And so when I heard this short video that was about an hour long, that one of our instructors played for us, so she was not a myofascial therapist, but she thought we should learn about this. It really struck me, the things that he was saying. So all of the injuries and things that I had dealt with in my life, I could see could very much be related to what he was talking about, even though it was just a brief introduction. So I was at the time in PT school also doing my PhD in biomechanics, and my minor was more anatomy, more gross anatomy. So in PT school, you get a year of gross anatomy lab. And then I had, more than double that pretty much. In my doctoral program. Yes, it was definitely double that. So all that time I'm working with the cadavers and seeing this connective tissue, which was fascia. And it was, oftentimes it would take hours to work through this tissue, and we never talked about it. It's like, oh, that's just connective tissue. So when I heard John explain this, it was like, wow, this is probably what's wrong with me. I just kind of had that feeling. So my own injuries through running, my headaches, and so on. Then in PT school at the very end, when you have internships and clinicals and whatnot, as fate would have it, I knew I wanted to seek out this work eventually, but I had this PhD to finish, right? My first clinical was with a clinical instructor who had just gotten back the night before the day that I started with her from myofascial release 1 with John Barnes. What are the chances of that, right? I was so thrilled, and I told her, oh my goodness, this is the work I want to do. I was so excited. And she told me she would teach me everything she learned over the weekend, and I could copy her notebook, and I could spend as much time as I wanted on my patients. So I did. And I had crazy success with it. I'll never forget this one guy. He was 34 years old, and they had referred him to PT because he had a heart attack 18 months prior, and he was still having chest pain, and they could not figure it out. They'd done all the testing, and it was, they went like this. And oftentimes when they throw their hands up, they send him to PT, right? So he was on my schedule. Here I am, the student, and I thought, well, okay, I do the evaluation, and I didn't know what else because he had fairly good range of motion, normal range of motion. He was seemed to be a healthy guy, so I just started doing these techniques: cross hands, arm pulls, neck release, flipped him over, did more cross hands, and the hour was up. So we finished the appointment. And then he came back the next time and he said, I don't know what you did to me, but I haven't had chest pain since I was here last time. Mouth drop, and I was blown away. And I had a few other experiences like that while I was on that clinical. So I knew that eventually I would do this work. So fast forward, when I finally did get an opportunity to go to a John Barnes class in person, this was after I had finished my doctoral studies and had been a PT for about 3 years, I realized I needed to have intensive work. So there were no therapists nearby, and I went to Sedona and got 15 hours of treatment in 1 week, which really started my deeper journey of self-treatment, because I went home and what was I going to do, So that's kind of how the very beginning of how I got where I am now. So back then, this is what I felt like. Do you see this little, all of the orange areas on the skeleton? You can see it's pulling the structure. The pelvis is elevated, the shoulder is down. All of these different things create a situation where you have a leg length difference. So one of the injuries I'd had as a runner was a stress fracture in my right tibia. So turns out I had a rotated pelvis and that leg was long, and then I was having knee pain. I ended up having 2 knee surgeries because I had so much activity in a state where my body was out of alignment, kind of like this picture. So fast forward a little bit more in February of 2000. Okay, so actually this is before I went to a John Barnes class myself, but I started working right out of PT school in acute care at St. Vincent Hospital, which is a trauma hospital. And I really poured myself into my work. Working with these patients who needed so much care, I really drained myself energetically and emotionally. And I ended up with mono in about 5 months and I was exhausted, but here I was working 35 hours a week and doing my doctoral program full time. So I had to quit exercising, which was kind of part of my, stress management at the time. And I decided, well, I've been wanting to do yoga for a long time. So it was 1997 at this point. I decided I would take a yoga class finally. And I walked out of that class saying, wow, this felt like total body self myofascial release. And it was an eye-opener for me. It was probably one of the best things that ever happened getting that mono for me, because it brought me to yoga. So a few years later, this was right after I graduated with my doctoral studies. I went ahead and went to the yoga seminar here, the integrative yoga teacher training. It was a 200-hour, very in-depth, 15 days long, 24/7 learning yoga. And it was fantastic. And right around that time is when I went to my first Barnes course, and it was all starting to come together for me. I got the instruction from John and seeing what the fascia was all about, and then putting that together with my yoga instructor training, it just started to really fill in the blanks. So I started creating different techniques that would help me feel this fascial tension, and it was like taking up that slack and feeling that softening. And I felt so much better on so many levels. So what happens to the fascia? Like, why was I feeling all of these restrictions, whatever was going on in my life? And even what happened when I was a child, and when I was in martial arts and all the different things that I had done in life, my body started to get this tightness or restriction based on what I had done. So that's unique to everyone, right? So everybody has their own sort of history. So sometimes our bodies will look like this. We've got, what's happening here? You can see all this misalignment, and you can often feel this inside your own body. So here's another example. I like to take that, oh, can you guys mute? I think there's somebody who's not muted, and I'm actually can't mute you if I am on the screen or sharing my screen. Anyway, here's the fascia man that we show all the time, but look at this example on the left with all of this red area. Everybody's different. So you might feel like your whole one side of your body is tight or feels different, and that's going to throw your system off in a different way, right? So I quickly learned that a lot of my problem was coming from the pelvis. And way before I even decided to become a physical therapist, I was going to the doctor and the orthopedist and having them look when I had this, tibial stress fracture. They were doing x-rays of me and they couldn't see anything wrong. Everything looked fine. And so, they're like, well, they kind of sent me on to the next thing and with no help, actually. Well, what I found out later is that what you can't see in this picture is the fascia that is hung up that you see here. So what's going to happen over time is this joint space that you see between the hip bone there and the pelvis, if you look at that little clear area, gets compressed together. And so we don't have the movement available that we should, but our body does what it can, and it kind of forces things, which then ends up in pain, right? But everything is connected. So the pelvis, if your pelvis starts to get hung up, what that's going to do is affect the knee, maybe, or maybe it's the ankle, or maybe it's the neck. Okay, so this is one of my favorite slides, just because I love this full body straitjacket. I mean, there were times when I felt like my whole body was in a full body straitjacket, you know? And I see this with my patients all the time. Well, your body can't move. The fascia goes through everything. And again, we talked about this at length in my last fascia focus forum last month. But what we want is what we see over here on the right, where everything can move freely. Because if that fascia is locked down on the cells of our body, our bones, our muscles, our organs, our blood vessels, our nerves, we can't function well. So the goal is to become more like this picture on the right, where you can move freely and come out of that straitjacket picture. We want to be more like Jell-O, less like concrete. Okay. So here's another thing I'll show quickly, because this picture is something that happens a lot. I see people so often with tight shoulders, you know, and as people age, they're not able to reach as far, and maybe they've realized they can't get to that second shelf in the cupboard, or other different things that they're trying to do with reaching. What can happen, and we get often very focused on the shoulder joint here, but it's actually the shoulder blade that gets hung up. Because watch this on the right here, as the body starts to move, you can see the scapula, the shoulder blade has to move to get that arm to reach overhead. So when there's restriction there and it doesn't move, then we're forcing at this shoulder joint. That happens also in other areas of the body, but the shoulder, I think, is just super key, because it's so much involved in what we're doing. The problem is, a lot of people go to physical therapy, and what happens, they start strengthening you, right? The problem is you can't strengthen a muscle fiber that's in a straitjacket. So remember that straitjacket picture, and then think of a muscle trying to move through that. It just doesn't work. And that was happening to me. I was feeling my strength fading. I actually had stopped doing any kind of training. I wasn't doing any running. I just couldn't. I couldn't do cycling or swimming. I was basically doing some walking, but I was in a lot of discomfort throughout my whole body. And, you know, I didn't know what to do. This was before I went to the intensive that I did in Sedona at the Barnes Clinic. So what can we do when our body is bound down like that? I'm just going to quickly go over the John Barnes principles, because these are key. I mean, if you're not following these, then you're not going to get the same results. So in self-treatment, I'm talking about, which we're going to talk more about here, I take up the slack and I hold at the barrier. I don't force tissue. So this isn't stretching. This isn't your typical stretching class or stretching technique. This is completely different, but we're in that mindset of like, oh, we got to feel it, you know, and make it really get there. When I first started yoga, I was in that mindset. I was so ridiculously tight. I mean, I would go to bend forward. My fingertips wouldn't go past my knees without me bending my knees. And I was in my 20s. I was so locked down that shoulder picture I just showed you, like that was happening in my whole body. Everything was getting stuck. And I was having headaches, migraine headaches, like most days of the month, taking Max Salt and Imitrex, heavy drugs, just to try and function. So what we want to do is back off that mindset and just take up the slack gently and hold at the barrier. We never force the tissue. And then we stay at the barrier and we feel beyond the barrier as a therapist connecting to the patient, right? But as a person working on themselves, we stay at that barrier and we just hang out and we wait. So we wait, if possible, 5 minutes, because it takes 5 minutes for the collagen to change shape, for the body to adapt. I love using this saying, the body will adapt to whatever we do and whatever we don't do. So think about that for a minute. It's going to adapt to whatever we do and whatever we don't do. So if we sit a lot and our hip is basically bent most of the day, your body is going to get used to that, which means it's not going to go the other way, which is extending backwards, unless you do something for it. Okay. So we also have to be patient, and it actually helps if we are very centered. So by centered, I mean really connecting into the body, and I'll talk more about this in a moment. But as we stay centered and feel what's going on and we let go of the outcome, meaning we're not in our head going, oh, I'm trying to force this, because that was me for a long time. I would get in these positions and I would try to really get there, it just doesn't work that way. So we don't get the benefits that we really need by forcing the system, okay? So what we do with this work, this type of mindset, is facilitate subtle energy flow. So our whole body runs off of an energy system, okay? When we do this gentle work, the engaged pressure that we're using on our body is not light nor heavy, but we're getting into the tissue kind of where it pushes back. Now, I'm talking about hands-on techniques or the ball techniques that I'll talk about in a bit, but also when, I like to think of the wall, for example, as something that would be pushing back at me. So as I do legs up the wall, I don't want to be so close to the wall that I'm forcing it and trying to plow past. I stop at that point where it's kind of like, okay, there's that sweet spot, and there's a way to find that, and I'm going to try to guide you through that. The sustained pressure following the gel that's inside the body, okay, inside the fascia, it kind of melts in a three-dimensional way. And you can actually feel this if you tune in well enough. And it actually becomes an art form of self-treatment. So we talk about myofascial release being an art form. Well, I think self-treatment is also an art form. It's something that we have to practice. There is something that happens called myofascial unwinding. And the picture of the cat here, because I believe that animals really do this all the time. You see them wake up and they're kind of rolling around on the floor, what have you, and they're listening to their body and they're letting their body do what it needs to do to kind of unwind the stress that's in there. So it's a type of body awareness that allows us to just let go. And I have a example of this happening to me. So before I really understood what unwinding was, I had been doing yoga for a long time, and I was doing legs up the wall back then before I even went to a John Barnes course, even though I'd already been taught myofascial release through that instructor I mentioned. And one night I was really, really relaxed. I was just really connected to my body. And all of a sudden, I got my legs up the wall straight, all of a sudden my head starts to go like this. It just starts to move real smooth and soft like. And I went, wait a minute, my head's moving. I'm not doing that. What's going on? And that was actually unwinding. So you can get to a place where you can let go enough and relax enough that the body actually starts to do what it needs to do. And it starts to let go of tension and stuck energy that's in our bodies. So when you get to that place where you can actually feel what you need, you can allow this release of stuck energy to happen. And often what occurs when we get to that space is the release of emotions. So it's not uncommon for me now, as I'm experienced in this work, to be able to get in a self-treatment technique and go into that space of emotion and to let it go. Like, no kidding, sometimes I could be on the foam roller and my heart is open, and it might even bring up tears. And I might not even know what that's about, but my body does, and I'm letting it go. So I just wanted to throw that out there because it's really important. And if you want to know more about that, there's a whole video on it in the YouTube channel. So how do we do self-treatment? How do I know what to do tonight, for example? It all starts with going into your body and feeling, okay? About 6 years ago, I think now, 5 or 6 years ago, I was really struggling with trying to help my patients do what I do, How do you know what to do to protect your body, to continue the progress that we've made in a session, or to even kind of, everybody has this thing where, oh, I did too much gardening last week, or I went on this, horseback ride and now I feel this, and what do you do? So the calm technique, I came up with this acronym because I started thinking, okay, what goes on in my head when I go to self-treat? And I realized that I could actually use the word calm. So C stands for connect. The first thing you have to do if you're going to treat yourself is you have to connect to your body and your being, right? If you're thinking about what happened at work today or what you have to do for your kids tomorrow or the grocery store or whatever, it's not going to work. You have to connect and feel inside. Then you're going to assess. You're going to say, okay, remember that fascia man? You got to do some things to tell where is your tightness? Where does your body feel off? And how can you feel that? Okay. And then the L stands for listening. So we're going to assess it. You might say, I feel really tight here because of the technique, which I'm going to show you in a few. Now what? Well, you're going to listen deeper to that. Feel into it even more and listen to what the body is telling you. Where's that connected? We have this saying, find the symptom, look elsewhere for the cause. So maybe you have a knee pain, but when you do the arm and leg lengthener series, you feel tension. Maybe your pain is in your left knee, but you feel tension between your right hip and your right rib cage. Okay. So that's listening. You're like putting the pieces together. And then move stands for either, and I joke about this, you either got to move off the couch and get on the floor to actually do something, or maybe you're in the middle of something and legs up the wall and your body's starting to feel like, this is a little too much. It's starting to get uncomfortable. Then you want to move out of that then. So that's what the M stands for. Okay. So connect, assess, listen, and move. That to get the most out of beginning your self-treatment and just continuing it. So again, the calm technique, it's body and emotional awareness is key. Because here's the other thing, and I see this all the time, and it's not talked about enough in medicine, but the National Institute of Health said this 30 years ago, that now they're saying 90% of all illnesses are related to stress, okay? 90%. So if we're ignoring this whole stress piece, we're missing a huge part of everything. So if you're stressed out or something's happened recently or all kinds of stuff, right? You may feel things more in your body, or you may also be trying to not feel them, right? Because it's uncomfortable. So we block it off, and then all this tightness in our body actually gets worse, and we don't want that. So body and emotional awareness is key. You have to do stuff daily. John talks about this in all the seminars, at least 5 minutes of self-treatment a day, because it's that consistency that's going to make the change, because our body adapts to whatever we do and whatever we don't do, right? So we have to be consistent. Here's the other thing. The mindset of empowerment. Mindset is so huge, you guys. I have this sign or it's just a chalkboard that I just wrote it up over a year ago. Our beliefs carry more power than our reality. So if I don't think that this stuff is going to do me any good, and I even am trying to do it, I am certainly not doing the calm technique, and it's going to keep me from making progress. There's tons of information out about this now. So Bruce Lipton, The Biology of Belief, he's the guy who discovered stem cells. It's an amazing book. I highly recommend it, or you can even Google him. Joe Dispenza, I crushed his 5 or 6 vertebrae in his back and healed it, was back to work as a chiropractor in 12 weeks because he believed and visualized and created this healing for him. So what I have discovered over 28 years of doing this work is when I help my patients see what I see and believe what I believe about their bodies being able to feel better and do better, they do better. And time and again, when I see patients who have been through so many things and they just have lost all hope, and a conversation with me or me showing them the fascia, and they still can't wrap their head around the fact that this could actually help them, they don't believe that it will, they don't do well. So it really starts with your belief. You have to. And this is why I like to educate, because the more you understand about fascia and you see that you have fascia restriction and you can actually do something about it, you'll start believing, heck yeah, I can take care of this. And you can, it's pretty exciting. So what I discovered very early on was that I needed to keep the pelvis balanced. So the favorite technique that I use is hip strap series and the legs up the wall. Both of them work really well, but I think the hip strap series is key for keeping the pelvis balanced. And here's why. I do these classes. I've done it, and actually started teaching yoga in 2000. Back then I was doing the hip strap series. That's when I kind of started creating the actual series that I have now and doing it in the steps that I do because it worked. And I added some things and I switched the kind of the specific, this stretch before this stretch before this stretch. And I hate using the word stretch, but this technique, this technique, this technique, because it flowed better and I could feel it in my pelvis. And, you know, I've been blessed with, or cursed sometimes, an ability to really feel and connect with what's going on in my body. So I can tell what's going on, you know? So as I developed this series, I found that my patients who were coming to my yoga classes, when they would do this series, their pelvis remained balanced. And now, even when I do these classes, I'll go around the room and tell the participant which leg is shorter, etc. And we go through the series, and most of them, they've corrected that by the time we're done with the whole series, which is pretty amazing, right? Because I mean, I know a lot of people go to get treatment, whether it's chiropractic, PT, or whatever, to fix their pelvis. Well, yourself. And that's what I've been doing, you know, most of the time for all these years. So here's an example. I literally did take a picture. This was something that I posted in the Facebook group, the self-care Facebook group on the left there. You can see those arrows, and I'm literally elongating from within my body. I'm lengthening because fascia responds to elongation and compression. Okay. So when we talk about biotensegrity, which is the structure of the fascia and how it's actually holding everything together in our body, this is what we know. Elongation and compression will reach in there, okay? So if you look on my right shoulder there, where I have that arrow, I've had this, you know, for years, this compression along that right side. So it's something I have to treat regularly, whether it's something that I'm doing, maybe it's how I sleep or it's injury I had or whatever, it's there. It's way better now. I barely have it now, which is so cool because I keep doing this stuff over the years and I got through it. So my right leg is elongating away and I'm opening up that space between my right ribs and my right hip. When I hold the strap with my right arm in this picture, it was actually giving me a release along my right side. So even though that strap is in my left foot, and to most people it would look like I'm just stretching my left leg, I'm not just stretching my left leg. I am getting into that whole right side of my body, elongating, and I stay there for a long time. Is it 5 minutes? I don't know. I stay as long as I can. A lot of the hip strap series requires strength. So it's something you build up over time. And you're not going to hold every position for 5 minutes. You're going to use the calm technique and you're going to say, okay, I'm connected, I'm assessing, I'm listening to my body. What's it telling me? Do I need to move out of this position or am I okay? And I'm doing that the whole time while I'm letting go of the outcome and feeling whatever is coming up. In this picture on the right, this is, you can see my running shoes there. Ideally, if I'm going to run, I want to try to open up my body afterwards. And this was a great position for quite a while when I was having a lot of hip tightness in the front. You can see the arrows there. I'm elongating beyond my knee. I'm lengthening up into the pelvis, my ribs. I've got my arm going the other way. My right leg is lengthening in a different way. And I'm kind of opening up all the ends of my body as best as I can, breathing into that and softening. And I'll tell you, when you hold something like this and you really connect and you're feeling what's going on inside your body, you get up and you feel different because the body's mostly water, right? We've got mostly water and these, you know, other pieces in the water, but we can change it. It's kind of like, you know, look at any body of water. It changes all the time and we can affect that. We can create a change. Okay, this was my accident last year. I won't go through each of these really long. I just want to bring this up again because, you know, this was significant for me. I mean, I've been doing self-care for all these years, but thankfully I had that experience because when this happened, I was able to really connect and assess what was going on in the middle of the emergency and listen. And I treated my body feeling and believing the whole time. So here's where I want to bring in the mindset again. You know, when I was lying there on the ground, I I thought of Joe Dispenza right away, and I thought, okay, I feel what's going on. You can see there, my right front tooth was directly behind my left front tooth. That whole entire bone had moved inward. So my head was smashed like this. And it was painful and everything, but it was like, okay, this is what it feels like when you smash your head on the concrete. What do I need to do? I can move this. I know the body is malleable. I know that by mostly water, I can move this. You know, there was a force that moved it there. What do I need to do to move it back? So I incorporated all of this experience over years and really focused on moving that. When I did it, it changed things in my brain. I ended up having a seizure in the ER. And then, of course, they took me to the hospital and had to do all this stuff. But for weeks, and I mean weeks, I was doing techniques like this every morning just to get my mouth open enough to be able to yawn without pain. But it worked. And I laid there and I took the time, and I could see myself getting better. And lo and behold, it did. Now, this was a month later, I went and had intensive treatment and, had therapists work on me. Also, you can see just in a few days, the difference there. And June 7th, you can tell my mouth is not open as far as the right. Look at my left eye. It's all pulled down. I mean, there's definitely some difference there. Same thing from the whole, look at my belly button. You can really see it there. My pelvis is totally torqued. And 2 days later, at the end of 2 days, 3 days of treatment, it's much different. So was I perfect by then? No, I was still doing lots of self-treatment every day, like through the next month. And then I was able to gradually kind of back off. But for about 3 months, I spent a lot of time every day. I was consistent and I just didn't give up, and I knew it was going to be okay. So this is the walking. This is on the left. I'm kind of walking with a little glitch there. On the right, much smoother. When I turn around at the end of me walking here on the left, you can just see me. I kind of roll my eyes. I was in pain. I was in pain walking there. See me roll my eyes. I was like, I can't do it. So what's missing in all of our courses that we learn is that we learn the muscles, we learn the bones, and no fascia is shown. The thing is, it doesn't stop in one spot. I really was working a lot in my head, and of course my shoulder and my pelvis, all those things were off, but the fascia goes all the way through. So this is where the listening becomes really important. And just to trust and that belief that you can make a difference. It actually starts in your head. It starts in your mind. Again, at least 5 minutes to begin a myofascial release that's changing the collagen. Does that mean something less than 5 minutes isn't doing anything? No, it doesn't mean that. It means that you're changing the elastic component of the fascia, and that's still really good to do. So if there's something that you'd like to be able to do longer, eventually you will be able to do it longer, and you just do what you can. So you're always listening to your body. Typical stretching is not self-treatment, okay? So holding postures longer is great, but if you can't do it yet, that's okay. You find maybe something else that can treat that area. Here's just an example of the self-treatment training, the coaching classes that I do, where we go through a lot of these. And, after 2 hours, we've done 2-hour ones, 4-hour ones. You get up from that and you feel like you've had treatment, but the idea is to make this part of your daily life. So lots of things on my YouTube channel. I use the toothbrushing thing there because, we would never think of not brushing our teeth, right? Plaque builds up every day, but so does fascial tightness. The fuzz speech with Gil Headley, I love it. Fuzz is building every day when we're not doing something to help it out. So even if you only have 5 to 10 minutes every day, and then a few other days of the week you're spending more time, that's great. You will see a difference. You absolutely will see a difference. So this is just talking about my Facebook group that's all about self-treatment stuff. So I will post things like this, kind of sharing some things that I've done that you might be able to get some help from. I do legs up the wall a lot. There's me holding my head. That was actually before the accident. Just something I always do is work on my body every night. Lots of things on my YouTube channel. The melt method is amazing. We're going to start offering more classes on melt. The hand and foot is incredible. The softer rollers, again, all using the principles of getting into the fascia. So same thing with my small ball. Here's the hip strap series, and these are old pictures. It's funny because I need to redo these. You can see that my arm is bent in the pictures in the middle there. I don't do it that way anymore. You know, things evolve. I found better ways. I'm always finding better ways to do things. So legs up the wall is, again, one of my staples. This is a course that that I have available to help guide you through 12 different sessions where I'm actually giving you guided instruction. It's really, really helpful. So I am going to, well, let me see. I'm going to go into this real quick. Here's a small ball. I wanted to show this because, you know, scarring inside the body is often ignored. And I have lots of stories about C-section scars and using the small ball to really help soften that solidified area. It can really make a difference in back pain, even bladder issues, hip issues, the list goes on. So these are the old pictures of me doing yoga and kind of creating and teaching people how to feel into their bodies. I'll share this last slide here with Barbara. She was a student when I was taking yoga back in 2004 in Washington, D.C. She, at one point in her life in her 60s, was in a wheelchair just to do things like go to the grocery store. They told her she needed bilateral knee replacement, and she just didn't want to do it. So she sought out Iyengar Yoga, a pretty famous yoga instructor in DC with very, very gentle techniques, very myofascial-like. And this was her at 79 years old. So, you know, the body adapts and we can make change, but how do we do it? So I'm going to leave with that and stop the screen share if it will let me. I've lost my, there it is. Okay, stop the share. Okay, so how do we know? I like to start with the fascia man, right? Everybody kind of can relate to that, where you see the side is all crunched. Years ago, I learned from an osteoporosis training with Sarah Meeks these wonderful stretches called arm and leg lengtheners. So I've adapted them a little bit, and I'm going to put this on speaker view so I can see you guys. And oh, I can't quite see it. Okay, gallery. What I do, and I encourage people to do this every day before you get out of bed. How do you know where your restrictions are? You just lie down on the floor and you create an assessment. You just are feeling, so again, this connect assess. I hope you guys can still hear me here from my mic. You're assessing, what does your body feel like on the ground? You know, so even right now, wow, I can feel the left side of my pelvis is closer to the floor than the right. So it's kind of like this, okay? I put my hands here. I put my hands on the top of my pelvis bone, and I look up, and lo and behold, my right fist is higher than my left. So you can do that really easily, and you can feel the difference. If you can't feel it on the floor or in bed, you can do this in bed. It's going to be more apparent on the floor, but I can see, so my pelvis is rotated like this. Now, as I feel my feet, it feels like my left foot is like rotated out more than my right. I'll take a look. Sure enough, it is. It's rolling out. Now I'll think about my shoulder blades. What's going on here? Those feel uneven too. My right side does not feel like my left side. And you might even be able to tell if your shoulder is closer to the ceiling on one side than the other, you know? Now, here's what's fun. A lot of times people think their head is straight, but when I'm looking at them as the therapist from above, it might be tilted to one side or the other. So what I have you do is like rotate your head one side. Oh, I feel some tightness on my right neck when I go that way. It's definitely tighter on the right side. You can even side bend. You can do a little, oh, my right side is definitely tighter. I feel a little crack when I go that way, okay? So now we're gonna go into arm and leg lengtheners. I'm going to bend my right knee, and you don't always have to bend your knee, but when people are first learning this, I think it's helpful because you're going to focus on the left side. So if my right knee is bent, I'm going to focus on the left, and I tune into my left foot and I pull my toes back towards me. Okay. When you do that, you might feel a little pull in the back of the calf. That's fine. You don't have to force it back so hard, like as much as you possibly can. You're just going to pull it back some. And now you're going to reach your heel away. So it's like, think of your heel reaching toward the wall beyond you. And if you even put your hand on your pelvis, you might feel your pelvis moving. So you want to do it enough where you're lengthening all the way up here. See if you can feel the pelvis move. Now, at that point, you really want to pay attention to what you're feeling in your body. Okay, so maybe you're just feeling it in your calf. Maybe you're feeling it in your hip. You might be feeling it in your neck. Okay, so wherever you notice that, pay attention and remember. Now let's just keep it gently lengthened. You're not doing it at full force. You're just going to keep it there. Now take your left arm, palm up, and slide it like you're doing a snow angel. So you know how when you're pushing the snow, you have to have your arm on the ground, right? So you got to bring it all the way up, and you're going to reach and lengthen through that arm. Now, if it hurts, that's where you stop. If all you can do is go straight out to the side, that's fine. If your arm comes up off the ground to get it higher, then we don't want you to go that far. So you just bring your arm out as far as you comfortably can, reach and lengthen through your fingertips and lengthen through your heel. And notice what it feels like on that side of the body. That's it. Now, if you're in bed and the headboard is there, bend your elbow and you can still reach and lengthen through your elbow here. So I feel pretty good along here. I feel maybe a little bit of tightness in my armpit here on this side, but I'm going to now switch it to the other side. Left knee bends, right heel blade. As soon as I pull my right toes back, it's tighter already. I can feel it on my calf is definitely tighter. I'm going to reach that heel away. And now I feel that in my low back, actually. And I'm going to slide my arm. Make sure you don't go like this. It's not about lifting straight up. You got to push the snow. Snow angel, reach and lengthen through the arm. I feel definitely more tightness around my shoulder blade in this arm. And as I'm reaching my heel away, I feel this in my sacrum. So you're just remember, so here we are, it's the calm technique, right? We're staying connected, we're assessing, we're listening to where that pull is going. And now the move is, I'm gonna actually stay here for a while. And I'm gonna wait for things to change. It feels, you know, I can definitely feel I'm tapping into something here. And I'm going to wait. So here's the cool thing about this technique. Oh, it was a little over a year ago. I started doing this one morning and I didn't have to get up and go anywhere right away. So I could really feel this big area on the right side of my spine down into my pelvis, kind of between my ribs and my pelvis. And I have a projection clock on my ceiling, so I can see how many minutes have gone by without moving my body. Because the thing is about the techniques that we're doing, we take up the slack and we engage the barrier and we wait, or we get into this position of, you know, where we can feel that we're engaging. And we don't want to change it, because if we move out of that, we have to start all over with our time clock, right? Because we're trying to reach that collagen that's stuck. So here I could see how long I was doing it and what was happening. I'm watching the clock. It felt so good. I could really feel that I was getting into this area. And so I just kept breathing and softening into it. Next thing I know, you know, 10 minutes are going by. I'm still holding it. 15 minutes, between 20 and 25 minutes, I start to feel this solidified area that was really tender begin to get smaller. And it just got smaller and smaller and smaller. And, you know, 25 minutes, 30 minutes, and around between 30 and 35 minutes, it went from about this big, about 4 inches wide, to about the width of a pencil. And what a difference. I couldn't believe it. So it just felt so good to stay there that whole time. That night, I did it again. It still felt good. The next day I did it again. It still was better. Unbelievable. So what you can do with this simple technique, I've since taught many people how to do this. And especially if there's like a pattern that's lifting their pelvis up and it creates a short leg length, for example, they're being consistent with this, they make a change, or they hold the position much better between sessions, for example. I even have a friend of mine who I showed this to one time and treated her one time, and she kept doing it. She changed so much in her body just from doing that, because she doesn't live near me. So it really is amazing what you can do with just that. So I might not always go through that series to decide what I need to do that night or that day for my self-treatment. But here's the thing, it's my experience over years of doing things like this, like the hip strap series, using the yoga strap to go over my shoulder, and like all those funky positions that I showed you in those pictures. Different positions that I have found that will tap into my tightness, and then I soften. I work on my mindset. I go into my body and I give my body permission to lengthen in that place. I believe, and because I can feel it's happening, and it changes. And I might not get exactly what I need with that particular technique. If I can tell that I still need more and I have the time, I'll try something else. So over time, what you do is you take these techniques, you apply them to what you're feeling. You assess and you feel all this stuff, you do a technique, and then you reassess. You see how you feel after that. Again, so if you lie on the floor before you do like any technique that you're doing, you do the technique and you lie on the floor again and you compare, you're going to see a difference. So from that, then you realize, okay, after today, like I know tonight I need to do hip strap stretch series, because the way my pelvis felt on the floor just then, I can tell I'm out of whack. I will do the hip strap series. I might also do legs up the wall, but here's what I found over years. Just doing legs up the wall, maybe every night, because a few years back I did a challenge. Okay, legs up the wall every day the month of June. And so I wasn't doing hip strap series as much. And I felt great the first week or two. And then things were kind of not right. I'm like, what's going on? Oh, I realized I wasn't doing the hip strap series. Well, that helps to balance my pelvis. So it is a different feel after I do the strap than after I do the wall. It's also different using the foam roller, where I just lie on it and I'm opening my chest. So I might not get that same opening with the hip strap series, which is getting into the back of the shoulder, that I do when I'm laying on the foam roller. You see? So you start to put all of these things together, and the ball, for example, that we can use in all different parts of the body, that's creating compression. And then other techniques that we do create elongation. And sometimes we do both. And sometimes we use our own hands. And we put these things together, and it's our practice of doing it and paying attention that allows us to determine what it is that we need. So that's been a lot of talking, but hopefully I'm kind of explaining for you what it is that I do to be able to find what I need, and then how I adapt to it. Can anybody come up with a question for me? Or maybe share an experience? Nobody. Anybody want to unmute?
Cindy, I have a question about
Yeah, go ahead,
when you were
Jamie.
talking. Okay, you were talking about when you find the barrier and you're not pushing past the barrier, and what it kind of feels like when you're taking up the slack for the self-treatment. So my question, like, it's hard for me maybe to feel where the barrier is and where you've taken up the slack. Does that just mean like before it becomes painful? Is that where you're trying to be, or how do you feel where that is when you're
Excellent question.
stretching?
Yeah, excellent question, because it is very much a subjective thing, you know? And so, yes, a lot of times people will use that word pain, the pain word, right? So you certainly don't want it to be painful, because if it's painful, we want to move out of it. That's the M, right? Now, maybe it's just discomfort. Some discomfort's okay. The way I judge it for myself is if I can breathe into it and I can relax my face, I can relax the area around it. So, for example, the day I was talking about reaching into that, even with just that simple arm and leg lengthener, it was uncomfortable, but it kind of felt good. And I don't mean no pain, no gain, or, hurts good necessarily, because we can go overboard with that. But there is a fine line. And I think it's something that we have to learn. And sometimes we learn it by making mistakes. I mean, I made a lot of mistakes that way. I'll give you an example. I used to have a lot of pain driving. And so I would, I had my orange balls, and then, I don't know, I had the idea, I'm going to use tennis balls. And then I bought these lacrosse balls. Okay. Lacrosse balls are hard as bricks. And it gave me a different sensation than the pain that I was having. So I felt like it hurt good, but it wasn't a good at all. It was actually way too much. And at one point, I remember doing this for about a month. And it was when I first moved back to this area and I started working an hour away, and I was used to driving like that. And so one day it just hit me. I don't know, what I'd been thinking before. I thought, I think these balls are too hard. Maybe I'm overdoing it. Maybe I'm forcing it, and it was like a light bulb. Hello. So I quit using those balls and I used my softer ball again. And then I even took something even softer. I would take a washcloth type of a thing. It was like a sock with stuff in it. And it made a little bit extra pressure. And oh my goodness, I felt so much better because I wasn't forcing past it, So you're almost better to think that less is more, so maybe get where you think it should be. Like, let's say it's legs up the wall. Okay. And get there. Maybe that feels good, but you know what, maybe I should back off a little bit. What does that feel like? What if I back off a little bit? Can I still feel a pull? Yeah, I can still feel a pull. I think I'll stay here. You see, that's kind of what I do in my head. Even still, I mean, sometimes I go back to that pattern of like, oh, this feels so much better to be here. And I realize, I'm probably pushing it, then I'll back off. I can still feel that I'm pulling. Well, if I'm pulling it, then the fascia still has to adapt to that position, right? So why don't I start there? Does that help?
Yes, it does. I have another question about legs up the wall. So the last one that usually is on there, the hurdle stretch, is kind of, I feel like my legs need that stretch, but it's hard for me to be in that position to actually stretch that part of it. So is there other options or ways to be in that position?
Yeah, a couple of things to think about. I love my yoga bolster. For one thing. So I had somebody in this today. I've been using the floor a lot at the studio. So we had done the legs at the wall a lot while I was working on them. And then I took the yoga bolster and put it under the leg. Let me grab mine. So we'll pretend that the wall is here. And I'm on the side. Can you see me still, kind of?
Yes.
Okay. So I'm going to put it this way. And so the wall is here. I've got my left leg is forward and I've got my right leg is going to go back. So you're probably having a hard time holding this leg up.
Yeah.
Yeah. So if you put something here to hold the leg, it helps a lot that way. And I don't want to be forward towards my knee that's bent. I try to stay vertical with that leg. If you have it available in the shoulder, you let the arm come down, because now I'm opening up my side body here and my shoulder blade. Okay. Now I'm bringing this arm, if I can, overhead. I might even grab that arm with my hand, my other hand, and lengthen away. And now my leg is just supported here. I can just hang out right here, just be relaxed, you know, but if I have something under my leg, I can relax this whole area as opposed to holding it actively there. And it does help. So now let's take that same idea and not do it at the wall. So you can even, I'll take my legs, like even in bed, I do this all the time in bed. My legs are bent, my feet are a little bit more than hip width apart, and I'm just gonna let myself twist a little bit. And maybe you even have a pillow here because you can't go all the way down, that's fine. But this top leg, I'm gonna move that foot back. I move that foot back. Now I'm opening up the front of this hip a little bit more. I'm not fully on my side, so you gotta be, you gotta make sure this is all okay. And maybe you even support yourself back here. But wow, right now I really feel this, like those arrows that I showed of those pictures of me on the couch and stuff and on the floor. I'm lengthening my knee away from my waist. Oh, and I feel that all through here. It feels so good. I bring my arm out to the side. Now that takes up even more slack. It'd kind of be like pulling two corners of a blanket that's on the floor, trying to spread it out. Now I'm opened up here. And I'm really getting into that same space that you get into on the side. So, and it's just easy to do because you're just laying there in bed, just feeling how you can tap into it. Is it the front of your pelvis where you feel it that you need it when you do that one? Yeah.
Yeah.
The other thing to get into that area, because that's an area that just really does need so much opening as we sit so much, as long as you can lie on your back comfortably, taking a folded up towel here, and this isn't very much folded, but if I put it underneath my pelvis and keep one knee bent, now I've got a little bit more extension here. You see how that is? If I make this bigger, a little higher, now, and I put it down towards my tailbone more so that my back is not arched too much, because you just got to play around with where you put it. Now you can see it a little bit more. You see how my foot is lower than my hip joint? So that is opening up this space. And oh man, does that feel good actually. I could now go into the arm and leg lengthener on this side, bring my arm out. Breathe and relax into that. I feel this pulling up into my hip, past my C-section scar area into my sacrum and low back. It's gentle. It's just a gentle pull. It's not painful in any way, but I can tell that it's tight there. Now I'm just going to relax my foot. I'm going to relax my whole leg. I'm even going to let this other leg kind of go out to the side. Ooh, that adds another factor. It got a little release, tension here in my inner thigh, but that feels good. And if I were to lay here for 5 minutes, which would be totally doable, my left hip is going to get used to being more open, because maybe it was bent all day, and now it has a chance to open up here. I'm actually feeling this into the sacrum on the right side with my right leg going out to the side. So I have a couple of things going on here. So I'm taking up the slack in a few directions, and my arms are out. This is so good to have our arms out like this, because all day long, usually we're fiddling with something in front and this gets tight. You see? Good question. That help? Good ideas?
Yes, it does. I've been able to sit up a lot more. So I think that's why it's getting tighter there. So it's good, but just need to keep working on that too. So thank you.
Yeah. Yep, you're welcome. Yep. Find ways to just make it easy, and it'll get there. Cool. So we are 10 after 9, I think. Wow. Somebody was going to ask another question. Are you still there? Somebody had another question. Nope. I'm looking at the chat here. Listening. Oh, she was listening while she did hip strap series. Yay. Super effective. She usually does legs up the wall, but have been needing hip straps to get hips and shoulder blades more. Yes. So, the hip strap series really does more than the hips. And my little story on that one is it's probably about probably more than 10 years ago now. I had a patient with bad neck pain and it was like 8 out of 10. And we were getting it down, but then by the time she come back the next week, it was back. And I remember she was a nurse who just had this really challenging job. And, when I worked in the medical setting where we took insurance, we used diagnosis codes. And so the diagnosis code was neck pain. And, you're not really supposed to do all this other stuff, right? Well, I could tell that her hips were really tight. And so I'm like, we're going to do some creative documentation here. I need to teach you hip strap series next time you come in. So she came in, of course, she had 8 out of 10 neck pain again. We did the whole hip strap series, took about 45 minutes. She got up off the floor and she said, she was shocked. I hadn't touched her yet other than to help her in these positions a little bit. She's like, my neck pain is like a 4. How'd that happen? She was tapping into all of it with the hip. And then I worked on her for 15 minutes. She bought a strap, came back the next week. And she said, I've been doing these every day. My pain has not gone above a 4 out of 10. Isn't that cool? So, she learned that she needed to do the hip strap series to keep her neck pain down. And this is how it starts to all fall together. And that might be different for someone else, but I have tried that multiple times since then. And for myself, if I have neck issues or strain or whatever, I know I need hip strap series because it's not just for the pelvis. It's because the pelvis is connected to the head and neck. Go figure. Okay, should we close this down, everybody? Thank you so much for joining me. This will be on the YouTube channel probably in a couple of days. Appreciate, all of your thoughts and comments and questions and sharing. If you're not part of if you are on Facebook and you're not part of our group, please ask to join. And I haven't decided what I'm doing next month yet, but keep an eye out for it. The first Thursday next month is the 4th of July. So I'm thinking of changing it to Monday the 1st, but I will keep you posted. So thanks so much. And I hope to see you soon.